And we have heard about the other coronavirus. In fact, you and I probably have suffered from coronavirus, some kind of an upper respiratory tract infection in our life. But the two big ones which are being thrown into the mix with the Wuhan coronavirus is the SARS epidemic and the MERS epidemic. How do you think the current episode of Wuhan or the novel coronavirus episode differs from these two previous epidemics?
Yeah. The similarities with SARS are important, but there's a key difference, and this is overall appears to be a milder illness than SARS, and the mortality rates with both SARS and MERS were much greater. I think potentially the mortality rate of approximately 2% now, if anything, might be a potential overcounting because you're going to catch all the deaths, but when much of the illness for most people is a mild flu-like illness, there's probably cases that have not been tested and that our total counts are probably somewhat low. So that percentage of that mortality rate is, I think, real, but if anything, a potential overestimate at this time. And so in SARS, you had approximately 10% mortality. In MERS, 35% mortality. Mm-hmm. And we're almost at the same number of cases now for this novel coronavirus as we had in total for the global SARS epidemic.